This is Coach Tess from HealthEversity, and today we are going to be focusing on modifiers. This series is going to be focusing on CPT modifiers for the CPC exam. So let's jump right into it. So this is the intro to modifiers, okay? So let's go with this presentation. Okay, so it is the CPC exam modifier. So hello everyone, and we're moving on to modifier 26. So I like to use my purple highlighter. So modifier 26. All right, so let's jump right in. Modifier 26. It's the professional component, and we use PC. Okay, PC or PC sometimes for professional component. So here we go. Independent radiologist. So when we're reading it, we need to know who did this. Professional component. Performed in a hospital. Where was this done? Okay, so let's jump to the next page. All right, so let's look at this. Modifier 26. Modifier 26 is appended to the procedure when the PC is provided by the physician. The procedure when the PC is provided by the physician. Okay? Modifier 26 may be used with codes in the surgery, radiology, pathology, and laboratory and medicine sections of the CPT code. So you see where we're going to use it? In this area, surgery area, radiology area, path and lab medicine sections of the CPT code. Okay? The physician providing the total procedure or global component, including equipment, services, and technical support to the interpretation and report, will not use a modifier to report the procedure because the physician is providing the global component. The TC includes the equipment, supplies, technician, and facility. So you always have to pay attention to when we're using modifier 26. Okay? Very easy. All right? I always tell my student, the PC is when the doctor is using the brain. They're using the brain. They're not touching anything. But when you're using the PC, is when they're using the brain, they're interpreting all of these things. But when they're TC, the technical component, is when they're touching. Okay? So that's how I always use it when I was studying for my exam. All right, so let's move right in. This is pretty easy. Okay? Dr. T.Y., a radiologist, interprets a 4-view X-ray of the cervical spine. So he's a radiologist and he interprets. And now we're going to use the modifier 26 of 72050. This is a radiological code, right? And we're using modifier 26. Okay? And remember what we said about the keywords. Professional component, independent radiologist, performed in a hospital, radiologist. Okay, so here we go. And we're continuing in our series of modifiers. Stay tuned. We are on to modifier 32, CPT modifier 32. Okay, so here we go with my purple highlighter. All right, modifier 32. So we're going to go through each paper, and as I always tell my students, I always mark on my paper just like you. Okay, so modifier 32 for mandated services. Why? They're going for a second opinion, and it's required by the insurance company. So a lot of the times the insurance company say, okay, go see my doctor. Okay, so let's go right into this one. This one is pretty short. Okay, all right, so let's get into modifier 32. Here are the key points. Modifier 32 is used when the insurance carrier or other governmental agency request, so the key word here, request that a procedure and or service is performed. Okay, this modifier may be used with codes in all sections of the CPT set. All right, modifier 32 should never be used with the patient and or family requesting a second opinion. Now you see what it says, patient or family request a second opinion. It is requested by the insurance carrier or a government agent. Okay, here it is. Modifier 22 is used commonly when workers' compensation carriers request, see, says a government agency, not the patient. Okay, the government agency requests an evaluation of a patient's condition. Okay, modifier 32 is not recognized by Medicare. Okay, so you make sure you know who requested that procedure. If it is some insurance companies, in their policies, they say it must be referred by a physician. You can't go and do a second opinion. Okay, your own second opinion? No, you've got to be requested. Okay, now it's what it says, insurance and government. Okay, let's move on to this question here. Okay, all right, so Joanne was in an automobile accident. His auto insurance company is mandating that he be examined by Dr. Spy to determine the extent of his injuries. Joe was already seen by his own primary physician. Because Dr. Spy's examination of Joe is mandated by the auto insurance company, modifier 22 must be appended to the E&M code that Dr. Spy submits. So see, the most important thing here is who requested it. The insurance company mandated that he be examined by this doctor. It's not by your doctor, by this doctor. Okay, so this is the context of this modifier 32, and we're moving on in the series. So talk to you then.